Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Glad that you could join us today. In studio with us, we have Mr. Chris Maddocks. He's Senior Vice President of Marketing and Communications for the March of Dimes Foundation. With us today to talk about the March of Dimes work in preventing birth defects, infant mortality, and premature birth. Welcome to Health Professional Radio, Mr. Maddocks.
Thank you very much. Glad to be here.
Thanks. Let us in on a little bit about a little bit of your background. You're the Senior Vice President of Marketing and Communications for the March of Dimes. Have you always been in fundraising or research, or are you a healthcare professional yourself? Tell us about yourself.
Yeah, so I've through no specific plan, I've ended up in a career in health communications and marketing. I actually had been a politics major and when I was in college, and I've found a real love for and working successively at organizations that are advancing the health of different individuals. So it's been a career journey, if you will.
Mm-hmm. So the March of Dimes, you say they're involved. Well, you didn't say. I said that they were involved in work to prevent birth defects, infant mortality, and premature birth. I mean, that's a huge undertaking when all three of those is something that we hear about. I wouldn't say daily, but at least on an every other day basis.
It's important work, and it's one that we take that scope very seriously. So preterm birth is the leading cause of death for children globally. Over 1 million babies die every year. And some of the different work that we do, whether that's on our advocacy work to improve policies in government to make sure that it's friendly for moms and babies and making sure that we get to those healthy outcomes, or on some of our research that we're advancing to truly understand, why do these things happen, and more than why do they happen, how do we prevent them? That's where when we think about, how big that mission is, we have a number of programs that help us really attack and understand and address those needs.
Are each of these efforts, do they each have their own prong, as it were, for lack of a better term, the infant mortality, premature birth, and the birth defects? Or in the course of you doing your work and talking with people and getting information and giving information, do you find things that help each one of those endeavors individually?
Yeah, it's a great question. So when it comes to the infant mortality, premature birth, and birth defects, those are all fairly, the incidence rates of each of those overlap significantly. So if you think of it like a Venn diagram, a large portion of, again, premature birth is the leading cause of infant mortality, not just in the United States, but all over the world. So those two things are very closely connected. And even with birth defects, that's a place where, again, it is actually the next leading cause of death for children under 5 are congenital anomalies. So we do see a good deal of overlap on those. And the good thing that's the negative side, but on the positive, with the work that we do to make sure that every mom is healthy and that every birth is, that is being monitored and the mother is receiving, the prenatal care that she needs, the interventions that we can help educate and reach women with and families, they tend to be similar recommendations and kind of work with communities. Regardless of which outcome or issue we're directly trying to influence.
As Senior VP of Marketing and Communications, exactly briefly, how does the March of Dimes reach out and connect with folks, people come in and volunteer information, or are you reaching out to folks that are already in the hospital having kids or dealing with their physicians?
Yeah, so there are a couple of ways that March of Dimes works with individuals and families. So we maintain one of the largest, locations and kind of destinations for authoritative health content. So every year, millions of women come to the March of Dimes seeking answers to their questions. Everything from is it safe to eat certain foods to when do I start prenatal vitamins, or I'm gaining weight and I'm pregnant, how much is a healthy amount of weight gain? So we we publish, again, mostly digitally, but we also do some print promotion to make sure that we're delivering for women and families where they are and kind of answering their needs. So that's a really significant piece of what we do. Another part of that is we do work with both professional associations like the American Academy of Pediatrics and other professional groups to make sure that that some of the guidance that we would offer are also pieces that are being delivered through to doctors and others within the professional space. Again, just to make sure that that clinicians are aware of what the current recommendations are. Mm-hmm. And then the final way that we really work with doing outreach and promote education and awareness is through our many programs, whether those be digital or physical, working in hospitals and with clinicians or in communities. We have a very robust set of community programs and partnerships that we work through, again, to help make sure that we are the single largest national entity covering maternal and child health, and we do that in communities. It's not just an organization that kind of sits above all 50 states and kind of is top down. We really work within communities to make sure that at the grassroots levels, doctors, physicians, community groups, that they are all working from the most current guidance and are working with their patients directly to make sure that these health outcomes are the best they can be.
There are so many things that contribute to infant mortality, birth defects, and premature birth. Does the March of Dimes focus more or less on factors, say inside factors such as genetic influences or maybe disease that the mother may have, or outside influences such as toxins from the environment, things of that nature?
Yeah, so we really try to take a holistic view on some of these things. So we absolutely are involved in making sure, whether it's issues like diagnostics and management for women that have a short cervix, or women that have had a previous preterm birth, where we're recommending progesterone shots. Again, those are some of the biological mechanisms that we look at, and we work very closely again with clinicians and with healthcare systems and providers to make sure that women are able to access those services and get the care that they need to help on that. That's not all we do. I think one of the pieces that people have started to hear and recognize March of Dimes as a leader in is really discussing, how do we think about health holistically. And one of the places where we've been talking a lot recently is on health disparities. So, what are health disparities? Essentially, what is the overarching or the larger environment that causes certain populations to have higher preterm rates than others. And one of a very specific example is, African American women within this country have a 48% higher rate of preterm birth than their peers from other races and ethnicities. Mm-hmm. So March of Dimes is looking to take a more holistic approach to that and think about, from the policy perspective, to access to care, to the environments of whether it's toxins or pollutants or, even broader issues like, structural racism or, multi-generational stresses and impacts on women and families. We're trying to take as broad a view as we can to help improve the health outcomes, whether that is biological sciences or policy or social sciences. We really are trying to support that broadest set of conversations that result in a healthy mother and a strong baby.
Absolutely. Now, in wrapping up, where can our listeners go online and get more information about the March of Dimes and about premature birth, infant mortality, and birth defects?
Yeah, I think the best place to go would be to go to marchofdimes.org and our website. And there, anyone can find information both on some of our interesting and innovative research advances that we're making, or on some of the specific topics related to premature birth and maybe even their own health.
Well, I thank you for coming in and speaking with us today.
Thank you very much.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, with Chris Maddocks, Senior Vice President of Marketing and Communications with the March of Dimes Foundation. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, download at SoundCloud, and see us on YouTube as well.